Hello, I'm Brian Mittman, New York disability attorney and founder of the Disability Guys, Markoff and Mittman. As you know, we love to bring information to people to find out what's going on in the world of disability. And today I am happy to have my friend and colleague, Dr. Howard Rombom, Director of Behavioral Medicine Associates, would it be a clinical psychologist or just a psychologist?
Clinical psychologist.
Clinical psychologist, and he has been in the world of disability and psychology for a few years, and he has many offices around the New York City metropolitan area, and we have done a lot of work together with clients, as well as Dr. Rombom has done a bunch of different studies and some things that we'll talk about today. So welcome on board.
Thank you. Good to be here, Brian.
Oh, it's good to have you here. So Howard, tell us a little bit about yourself.
Sure. I'm a psychologist, and my practice, Behavioral Medicine Associates, specializes in treating injured workers, people who have problems as a result of some kind of incident or accident on the job. We treat two different kinds of patients. The vast majority of our patients are those who've had physical injuries, and after a period of time find the injuries do not resolve, they don't get better, they're suffering from chronic pain, they're disabled, and their whole lives have turned upside down. So we see those patients, and our goal is to help them cope better, provide them with skills, insights, understandings they can use to enable themselves to go back to a full life, even if they have physical limitations.
Well, that's super important, and in this day and age where benefits are becoming more and more limited, I think it's a excellent life skill to have. So what is, for the audience, what is clinical psychology, or a little more in-depth? So somebody has a work-related injury. Truck runs over their foot, they bang their knee into the desk, they have a car accident while working. Tell us a little bit about the things that kind of somebody should look out for, or they would see to say, wow, maybe I need more than just medicine.
Very often psychological factors are overlooked when people have physical injuries, and that's understandable. People first want to treat their pain, get their injuries treated and taken care of and diagnosed. What happens after that is that people begin to have difficulties sleeping. They have difficulties, they find themselves more anxious, more irritable. They snap at their wives and their children and their friends. They become socially isolated. The impact of the accident, the impact of the injury begins to weigh on their entire lives. They may have limitations. They can no longer do the kinds of activities they used to do. They can't help their children play ball. They can't lift their babies out of a crib. And this causes them to feel distressed and depressed and uncomfortable. Sometimes they don't even notice it because it's a subtle process. That's a really interesting description. I mean, it's accurate, but one of the things that I'm sure you have heard that's part of popular culture is, well, come on, just battle through it, get through it, what's the big deal, get back to work. And again, in the world of New York workers' compensation, for instance, as you know and I know, the last 10 years have been incredibly difficult from a medical perspective, where more and more people are being forced back to work, not only before they are mentally ready, but before they're physically ready. So how do you debunk that myth? Just kind of muscle through it, everything will be okay. Well, we're not medical doctors, so that we always tell the patients, you listen to your doctor and your physical therapists and those people who tell you what you can and can't do physically. But should you not get better, should you have lingering, debilitating problems over time, we can help you learn to deal with that. We can help you understand that there still is life after your injury, that just because you're injured, maybe you can no longer get on a scaffold and build a building in Manhattan. There are still things you can do and things you can enjoy and activities you can get involved in which are going to provide you with some sense of satisfaction and joy in life.
And you alluded to it, but I want to be clear for anybody that's listening to this particular video, is that you can go back to work but still get treatment.
Yes.
Or still get coaching or psychological treatment, whatever you might call it.
Yes, many of the people we see who've returned to work continue to come to see us on a regular basis to maintain the gains they've achieved and to deal with other problems that may occur as time goes on as a result of their injuries.
And another thing that we see, particularly in New York workers' compensation, is that it's one law, no matter what you can say good or bad about it, it does allow for psychological treatment to take place without necessarily a lot of undue burden on the individual who is seeking that treatment.
Yes, under New York State workers' compensation law, injured workers are entitled to treatment, entitled to psychological care. They don't need any special entrance criteria to receive it. Have to call our office, make an appointment, and we'll see them.
So we have a few. I have a few questions and things. You know, I try to do my research once in a while here. So you know, we mentioned it briefly, but I want to go back to this because it's so important, and I see it every day. People get injured on the job. They're dealing with the physical manifestation of that injury, and as you said, they start to develop potentially anxiety, depression, whatever the words are that you want, but things don't seem to be exactly right. So why is it so important, though, to get treatment for that? Wouldn't just going back to work or taking, reducing the pain be enough? Why is psychological treatment so important?
For the acute injury, where the person gets better and goes back to work within a few months, psychological treatment may not be necessary. That's the normal course of recovery. You get injured, you go for treatment, you go for some therapy, you're better, you go back to work. You've had a brief hiatus, a brief pause in your ability to work, and you go back. Mostly we see people who either have traumatic injuries, things that are so debilitating or so horrific, loss of limbs, loss of fingers. We see a tremendous number of patients who've had traumatic events occur, train operators who hit people on the tracks in the subways. For those people, immediate care is usually the best.
Right.
For the chronic pain patients, the patients whose physical condition lingers over time, those are the patients who really need our help, both support as well as specific behavioral skills, techniques that they can use to improve their lives. And it's not only the worker himself or herself who winds up suffering, it's the entire family unit suffers. So the mother can no longer prepare meals, can no longer take care of her children as she once did because she's now injured and can't move physically as well. The father who can no longer take his son out to play ball or join his friends at the barbecue on the weekends. And the whole family constellation, the whole family dynamic changes dramatically. So not only is the worker suffering, but the family suffers as well. And we will often see entire family units to help them get back their rhythm of life and develop ways of handling the changes in the family dynamic.
Okay. I know a lot of people listening to this say, wow, that sounds good, but then when they start thinking about it, might have some more detailed questions. And again,
Sure.
I know there's not one answer for anything, but you talk about behavioral skills. Could you give me an example, give our listeners an example of maybe a couple behavioral skills that somebody might not have thought about, said, wow, I wouldn't have thought of that if I was injured, that's something I had to think about.
Sure. Most of the patients who are injured have muscle injuries. They have pain. And the more people tighten up the muscles or tense the muscles that hurt, the more they're going to hurt. Now, we all brace to pain. That's a typical response. If you hurt, you go, oof, and you brace to
Right.
pain. Unfortunately, that bracing is just going to take that same muscle that's hurting and make it hurt more. So we'll teach patients a series of relaxation exercises, ways to identify the fact that your muscles are tight and learn to relax them. And there are probably 2,000 to 3,000 different variations on that. So there's always a technique or a way we can help somebody regardless of their background or their ability to handle these exercises.
Interesting.
We have a CD with relaxation exercises on them and we give out to our patients so they can take them home and practice. That's a very concrete aspect. The most elegant approach we use is to help the patient understand that the way they think about their life, the way they perceive what's going on in their lives, makes a tremendous difference in how they feel. So if they define themselves as hopeless, helpless, unable to do anything about their own condition, they're going to feel more depressed. It's our job to energize patients and teach them that perceiving their situation in a less than awful manner is going to make them more productive and more able to focus successfully. Right. When we talk to ourselves, we tell ourselves very destructive things very often. We tell ourselves things like, I can never do that, or I'll never be able to handle that. And that's a self-fulfilling prophecy. That's exactly what's going to happen. I'll give you a little brief example. Imagine you're on an elevator in Manhattan, Christmas time, and you're getting in and the elevator's tight and the door closes right in front of your face, and it's an express elevator, it's going to the top floor, and as you're going up slowly in the elevator, you get whacked in the back of the leg. Well, the first time you take it for granted, it's New York. That happens. Okay.
It does happen.
And then you're going up and you get whacked 2, 3, 4 times. What happens? You're starting to get angry. Oh, and you're really getting angry. And I'm going to get this guy behind me who's hitting me in the leg when the elevator comes open. The door finally opens. You turn around, and the man behind you is wearing dark glasses. He's carrying a cane. He's blind. What happens to the anger? It's gone. What changed? The situation didn't change. What changed was your response to the situation. From this nasty so-and-so, he became this poor, unfortunate blind man, and your anger dissipated totally.
That is a great story, and it's so true. I mean, just forget working with the injured individuals. Just seeing how attorneys react in a courtroom. Oftentimes, you sit there and you scratch your head and you wonder. So, in a certain sense, what the behavioral skills, what the I believe you referred to this as cognitive behavioral therapy.
Yes.
What it's really doing is you're looking for not so much the symptoms, but really the cause. And you're not, quote, curing a cause, but you're giving people the skills or the tools to be able to look at or perceive the situation differently.
That's correct. Absolutely.
That is so powerful.
And when people can do that, the power of that is dramatic. Championship athletes never think of themselves failing. Never. Jack Nicklaus never said, I made that bad shot, it was my fault, I'm no good. He always found some other way of explaining it, so he never put himself down. He never put himself in that position.
I always try to say every shot is a new shot. Yes. when I swing the golf club. But I think, I'm not sure whether it was I think it was Jack Nicklaus as well. As he talked about one time envisioning each time what his swing looks like, where the ball was going, and what it was going to be. So if it was a bad shot, not saying, oh, that was a bad shot, but saying, finding not another excuse, but another explanation that's more positive is really what we're talking about.
That's exactly correct.
This is great stuff. And let me ask you this question, because this discussion and this concept is fantastic, and I know about it from personal study and things that I do, and working with you and working with people. But we're also in a world where, again, we're dealing with insurance companies, we're dealing with the workers' comp board, and they want things black and white and done in a certain way. How have you seen this push to move cases along faster affect your ability to achieve better outcomes for people?
We've been very fortunate. The workers' comp bar attorneys like yourself and other workers' comp attorneys have been understanding and appreciate the value of our service and the value of what we do for their clients. The judges in the workers' compensation field over the years, I've been doing this probably 20 to 25 years, have learned and began to understand the impact of injury on patients, not just the impact physically, but the impact psychologically. So that I'd like to think that what we've done over the last 20 years is educated the judges, the workers' compensation judges, and the insurance carriers about the importance of this. We are a specialty practice in workers' comp, so we're comfortable and accepting of all the workers' compensation paperwork, logistics, heartaches and difficulties, and that's part of what we do.